guys, good afternoon. It's another beautiful Wednesday lunchtime, and of course, our weekly lunch date with wellness and health. Good afternoon, Ma'am Betty. How are you?
Hi, Raymond. Good afternoon. Welcome everybody to the show. It's a very interesting topic for today. We're going to deal with one of the basic necessities in life.
Mm-hmm.
And
Ironically, most often than not, neglected or I don't know, may traumatic experience or may fear, things like that. No,
yeah,
when we
oo.
talk about
Pero,
a dentist, oh, I hate to see the dentist. Parang ganun, di ba?
oo, tama. Pero yun na nga, we're very lucky kasi our guest, she's one of the, kasi there are actually 7 fields sa dentistry. Madaming specialty ang parang doktor, di ba? Madaming specialty. But what I like with our guest is she trains the trainers kasi
Oh,
she
wow.
has a master's in health professionals education. So,
Mm.
today, fortunate tayo kasi yung televiewers natin, they will get some training on how to change their mindset about the
Mm.
dentist, di ba? Kung
Correct,
ano man
correct.
about oral care. Kasi remember,
Yes.
pandemic di ba?
Yes
Kailangan we
po.
should take care.
Ay, oo.
Everything in our body, sabi nga natin, holistic ang approach to health.
Mhm,
Pero
mhm.
yung teeth, it's very important. Dati nga there was a naturopath leader, si Dr.
Mhm.
Huda Clark. Sabi nga niya, all disease, dalawa lang ang cause niyan. One is pollution, the other one is parasite. And the parasite,
Mhm.
they come from bacteria, di ba? And
Mhm.
our mouth really has a lot of bacteria, di ba?
Mhm.
So without much ado, I think we should now welcome our guest kasi baka kulang yung isang oras, no? Uh, let's all welcome Dr.
Oh,
Chrissy
wait, opo.
Valerio
Sige,
of
we will take
Vibrant
opo.
Smiles.
We will be taking a break kasi medyo nawala po sa stream eh. Baka nag-reset yata po.
Okay.
Nawala sa backstage. But, of course, she will be here in no time at all. Kaya we'll take this opportunity to play na rin some of our reminders before the introduction. Okay,
Sige.
so...
Naman si Doktora, she's also very talented. Diba?
Oh, yes. Ang
Nag-video
ganda po.
edit, no? Dentist nga, pero nag-video edit siya.
Yes, nasa media rin siya. Yung arts, creatives, nasa creatives. Actually,
Yes.
shinare nga natin yung kanyang video that she did. We shared that several times actually in all our Facebook pages ng Edge TV Philippines. Yeah. So mga 4 or 5 pages yan. Okay, so we'll be back, guys. Don't go away. This is an exciting segment, one solid hour of nothing but oral care, redefining it by breaking, our, bad mindsets about it. Okay, matakot. Because, very friendly. Actually, one of our best friends should be our dentist, no? Kasi, lalo ngayon, bawal talaga magkasakit, di ba? While staying at
Yes.
home, pwede pa rin naman
Frontliner natin sila. Sabi,
Opo.
they are exposing themselves Once
Kasi,
we
di
open
ba?
our mouth, diba?
Transmission
Nandun ka sa
mouth.
dental chair, no?
Correct.
Oo.
Correct.
We should thank our dentists, especially those na nagbubukas pa ng
Mag-open,
clinics
yeah.
ngayon. Oo. Ayan.
All right. Good afternoon again. And of course, our special guest is in the house now dito sa ating online show. And welcome po, Dr. Chrissy.
Hi. Good afternoon to everybody.
So,
Kumusta?
yan. Sabi ko sa'yo, talented si Doktora Nag-video edit.
Ganda.
Dentist nga, pero nag-video edit
Oh,
pa rin,
ganda.
no? But thank you very much, Doktora, for joining us today. I know you're very busy. Kasi nga, di ba, lahat ng dentist yata busy. Ako nga, hindi maka-appointment sa dentist ko
Kasi talagang medyo hindi madali maging dentist ngayon. As you said earlier, they are also part of the frontliners. Actually, hindi lang frontliner, talagang they're parang in your face, di ba? Talagang in your face.
Yes, totoo po yan.
So yung parang a lot of people are now afraid to go to di ba? The dentist. So before we head on to our main topic, siguro we should ask the first question. ito yung million-dollar question kumbaga ng marami. Is it safe to go to a dentist now because of the pandemic, 'di ba? Paano po ba yung yung mga safety protocols talagang can we like you're part of the Philippine Dental Association po, and can we assure our patients of the safety of anybody who wants to go to a dentist these days?
Napaka-safe pa rin pong pumunta sa dentista at kailangan natin pa rin ng dentista. The Philippine Dental Association came up with interim guidelines for safe practice so that the dentists can assure their patients of safe environment inside the clinic. So may guidelines pong nilabas ang PDA. At kami naman, syempre, ang pagsunod namin sa guidelines na to can protect not only our patients, it also will protect ourselves and our families. Kasi if we get the virus, syempre iuwi rin namin yan sa pamilya namin. Kaya maraming dentista po ang naghanda. Everyone prepared na mag-reopen ng mga clinic. Diba? There was a time na nagsara po ang mga clinics. Nagsara kami not because we are afraid of the virus, but we want to make sure that we do not contribute to the spread of the virus. That is the reason for closing our clinics. Now, when we reopened our clinics, it means na ready na kaming harapin ang responsibilidad na gamutin kayo na hindi natin maikakalat ang virus at hindi rin natin maipapasa sa ating mga pamilya. Very safe po yan kasi sumunod po ang ating mga kasamahan.
Okay. Siguro po, the one thing that the patient should remember or make sure na ito po bang particular dentist is a member or active member of the PDA? Kasi
Yes,
yun yung parang yun yung nagbigay ng safety protocols at para make sure that each dentist and dental clinic is compliant, di po ba?
Yes, totoo po yan. Mahalaga po na ang inyong pupuntahan ay una-una lisensyado, tapos member po ng Philippine Dental Association dahil ang aming mga miyembro, they are well educated and informed of how to practice at this time of the pandemic. So susunod po yan at I can assure you, sorry, nabubulol sa Tagalog. I can assure you that our members who have complied to these guidelines can provide you a safe environment when you go to our clinics.
Okay, especially kasi pag nandyan si Doc Chrissy, diba? She trains the trainers continuous ang education ng mga dentists, diba? So they upgrade their skills, ganon, diba? So that pero during this pandemic, how do you make appointments naman? Kasi I've heard some of the dentists, they lessen their days of work, 'di ba? So I think the best approach is to make parang kayo mga doktor merong teleconsult, paano ang dentist?
It's still called telemedicine. So ang telemedicine po, it is not something that new to the practice. Marami na po ang gumagawa niyan. Ako even prior to the pandemic, I have a Facebook page where my patient sends message and we set up appointments. Ngayon po, mas marami ng dentista na ganyan na po ang ginagawa ngayon. Ang mga pasyente would have to ask for a teleconsult. So magko-consult muna online, pag-uusapan kung anong problema ng pasyente. We try to do a triage. Titingnan natin, urgent ba? Or ito bang condition na kinukonsulta ng pasyente, will this lead to an emergency? So uunahin natin ngayon yung mga pasyente na may mga emergency concerns. Tapos, isiset natin po ang appointment niyan. We also have to screen our patients for any COVID exposure. So may proper screening yan. Kaya it can add to safety in the clinic.
Siyempre, ayaw din naman natin mabawasan yung mga dentist natin, no? Kulang na nga eh. Di ba?
Totoo po yan. Napakalaki. Sige po.
Yeah, pero curious lang kasi ako, doktora. Sabi ko, sabi nga natin, very important ang teeth, di ba? It's something that you have to deal with from womb to tomb, right? So, kunyari, when the mom is pregnant with the baby, kailangan madaming calcium, 'di ba? Para strong teeth siya pag lumabas. At least, kumbaga, yung foundation is stronger so that there will be lesser intervention by the dentist, right? And then it's also important na uh, I think during the life naman, it's I think you were telling me about yung indigestion, 'di ba? When we don't have our proper teeth. So, most especially yung mga bata, matanda, kailangan maganda din yung mga ngipin. And then, pag namatay naman din, sometimes for autopsy, kailangan din it helps in identifying a person. So, very important nga ang ngipin, di ba? Pero bakit doktora, yung ibang tao natatakot sa dentist? Especially
Yan, di ba?
males, di ba? Especially mga lalaki, no? Sabi ko, like my husband nga, sabi ko, punta ka na ng dentist. Ay, nako. Sabi ko, as long as they can delay it, they will delay going to the dentist.
Okay.
I don't know why.
I'll answer your query about ba't natatakot, pero let me add first na yung from wound to tomb, we have to acknowledge that kailangan ma-inform muna natin ng ating mga viewers at mga nakikinig na hindi lang tamang pagkain ng mommy na habang nasa tiyan ng bata. There is what you call a vertical transmission of bacteria from the mouth to the baby na nasa sinapupunan. Kaya importante din na habang buntis ang mommy, siguraduhin na walang bulok ng ngipin, walang namamagang gilagid, because the bacteria inside the mouth can be transmitted to the baby inside the womb through what you call a vertical transmission. Kaya hindi lang sa tamang pagkain, kundi sa tama talaga na health status ng bibig ng mommy. Now, let's go back to the fear. Bakit ba takot sa dentist? Unang-una po, kaya nga we are changing their mindset kasi talagang naaalala ko ginagawa kasing panakot ang dentista. Diba? So, bata pa lang, meron na kagad nasa isip niya na, sige, ang likot-likot mo, dadaling kita sa dentista, papupunutan ka na ng ngipin, papa-injectionan kita. So, that's the first thing that we need to change. Oo, dapat makikiusap tayo sa mga magulang na please, huwag mo ipanakot ang dentista kasi pag ipinapanakot ninyo ang pagpunta sa dentista tapos sumakit ang ngipin ng bata, it becomes now a problem because you have established fear in the minds of the children. Kaya kung takot na sila sa amin, nasa may pinto pa lang, I have a patient like that nasa pinto pa lang yung bata, nag-iiyak na yung bata. Kasi nga, pag nagpapagamot si kuya, naririnig ko dun sa reception, sinasabi nung mami sa bata na, huwag kang malikot dyan, sige, ikaw ang isusunod ko, patutusuhan kita ng injection. So, that's the first thing that we need to remove. Tanggalin muna natin yung establishing fear in the mind of a child na nakakatakot ang isang dentista.
Kawawa naman, nakakahiya naman sa mga dentista. They don't deserve it, maging friendly nga, di ba?
Tsaka hindi naman yung unang puntas mo sa dentist, bubunutin na yung ngipin mo, di ba? As much as possible, we try to save our teeth because it's very important.
That's another point.
The duty of a dentist, di po ba? Well, before we continue, meron kasi first time sa Health Revolution page, may pumati. Si Ray Gabriel Escudero, good morning. Thank you for watching. Thank you.
Yes, hi Ray. So let's go to a second point na mention ninyo na kasi hindi naman dapat magpapabunot lang pagpupunta. Because in the Philippines, oral health is not a priority. Kaya anong nangyayari po, ang first dental experience natin kung kailan sumasakit ang ngipin.
Tooth extraction.
So, kung meron ka ng existing pain, tapos first visit mo sa dentist, ang unang ma-establish talaga is fear. Kaya nagkakaroon din ng takot. Kaya dapat, mga mommies, iwasan natin na ang first visit ay kung kailan may masakit na ng ngipin. Pwede naman talagang pumunta sa dentista para lang magkonsulta, para ang bata ma-establish muna yung trust and rapport with the dentist. Kasi once established yan, mawawala yung factor of fear. Diba?
Parang
Kasi kung
therefore, check-up lang, diba? Pwede naman ganun,
yes.
doktora.
Diba? Kung may well baby check-up, pwede din naman ng well teeth check-up. Pwede naman na mag-establish muna tayo ng friendly atmosphere inside the clinic at ma-establish ng dentista yung trust. Another thing kung bakit tayo takot sa dentista is because yung kadalasan ang nararamdaman natin na pain in the setting. Halimbawa, ngayon, magpagamot ka. Bakit takot pa rin ako? Pero I'm of age na, matanda na ako, pero takot pa ako sa dentista. Wala pang ginagawa. Yung pulse rate mo masyado na mataas. Kasi po, ang naaalala natin is the painful experience. There are studies to prove that the pain that you feel now in your current dental visit is the pain of a previous dental experience. Kaya ngayon, para mawala yung fear na yan, kailangan maka-experience tayo ng multiple dental visits na pleasant, na hindi na masakit. So, para mawala yung mindset, mawala sa perception ng isip na tuwing uupo ako sa dental chair, nagpapalpitate na ako kasi naaalala mo na yung previous experience ng bata
Yung
pa.
extraction, experience. Well, of course,
Ako
there are
wala
ways
pong
how to
problema
avoid-
dyan.
to avoid it.
Nakakatulog kaya ako sa dental chair sa pagod.
Diba? Parang resting mo
Kaya,
pala yan. Parang
no fear.
unwinding mo pala yan, ha?
Kasi
Nagalit
yan,
sa dentista.
sa mga audience, yan ang the very basic, di ba, na kailangan natin palitan. We should change that. Kasi nga, we should be proactive. Pero Filipinos kasi also, even in the health aspect, hindi din kasi proactive tayo. Pupunta din tayo ng doktor pag may sakit na. So in the same manner,
Hindi pa pag malala na. Pag malala na.
Oo. Malala na rin yung sakit, tsaka na lang pupunta. Di syempre, it's not a pleasant experience, di ba? So right now, what we should do is, change our mindset by removing that fear. Kasi hindi naman nakakatakot ang doktora. Mga doktora, mga dentist natin, ang gaganda nga nila eh. Dapat lagyan siguro ng spa music yung mga dental clinics.
Hindi pa mga bata, dapat medyo iba yung aura. Kailangan nandiyan sila, sila
Yung mga bata,
o yung mga
bata dati, yung mga anak ko nung maliliit sila, ironically nga the dentist has a stock of candies nandun sa sa clinic niya. Kasi wala kang magawa kasi kids like pero she always tells them naman, and then you brush your teeth after.
And it's a reward system naman yan. Hindi mo parang, sige, pagka nagpa-dentist ka, bibigyan kita ng ganyan. Dapat hindi gano'n. Dapat maging good girl siya, tapos at the end of the treatment, there is a reward. It serves as a motivation.
Yes.
Diba?
Yes.
So yan training the trainers na si Doc Chrissy, yung mga dentist daw, ganyan daw yung dapat gawin nyo. Use the candies as a reward.
Yes.
At syempre, let's not forget yung sa parents and the elders, ate, kuya, don't scare your kids. Kasi ginagawang pang-discipline kahit nasa bahay, di ba? Pag matigas ulo, at sabihin siya, di ba parang, kainin ka ni Bombay, malaking tiyan ni Bombay. Ngayon, some people use dentists, some people use, di ba? Pero, please don't use the doctors and the dentists. Kawawa din yung mga kids. Especially, sila na nahihirapan. Pag it's time na to go there, di ba?
Oo. Kung kailan tuloy kailangan nila ng dental treatment, takot na sila.
Away.
Nasa isip eh.
Ano pa ba ang katatakutan sa pagpunta ng dentist?
Kasi ang nasa isip, pag pumunta sa dentist, magpapabunot ng ngipin. The dentist is not there to remove your teeth. Dapat maalis din sa isip natin na ang pupunta lang sa dentist dahil nagpapabunot lang.
Pabunot. Yeah.
Kasi marami namang mga preventive treatment which
Okay.
provides a pleasant experience usually, lalo na pagka yung unang visits pa lang. Kahit sa adult, hindi naman puro bunot lang. Why wait for kailangan mo magpabunot? Pwedeng
Correct.
magpalinis ka ng ngipin. It's really a pleasant experience. Napaka-painless naman magpalinis ng ngipin with all the advanced technologies in the dental practice. Napaka-moderno na po ng practice ng dentistry.
Yes.
Marami
Sarap
ng
din ang
mga
feeling. Sarap ng
marami
feeling
ng
pag
available
bagong
na
linis.
gamit. Yes.
How
Hindi na
often,
kagaya nung araw.
Yeah.
how often should we go for cleaning of the teeth?
It depends on gaano kabilis ka makadevelop ng
The
deposits.
plaque.
Ang standard dyan is you have to visit your dentist every 6 months. But there are patients who would need more frequent visits kasi madali siyang magkaroon ng mga plaque or deposits in their teeth na hindi kayang tanggalin niya ng toothbrush lang. Kailangan talaga ng gadgets o yung mga gamit ng dentista para sa paglilinis. So it depends on the oral health status. Minsan, sa una, kailangan mo makita yung dentista more often. Tapos habang tumatagal, as you develop a good habit, tapos na-establish na gumanda na rin ang flora ng bibig, mas pwede ng every 6 months na lang. So iba-iba yan. Oo.
Yes, ang ganda ng, huwag natin kakalimutan yung mga tinuturo ni Doktora kasi ito, hindi lang para sa personal, especially if you're a parent or an ate, kuya, tito, tita, no? Let's not use it. So, but it's now 12:32. Let's take a break po muna and we will continue with the wrong mindsets kasi we're here to redefine oral care para ma-overcome yung mga wrong mindsets about dentists like Doc Chrissy, no? Na very hindi naman sila yung the typical na pag nakita meron kagad na no yung mga pliers at ano. It's the wrong image that we have been imagining or we have been taught with the wrong images or perception, di ba? So we'll be back, guys. Don't go away. This is Self-Evolution. We'll just be back in a very short while. All right, we are back. Yeah. Position. Yeah. Okay, let's continue po.
So, So, Doc Chrissy, di ba, kailangan proactive. At least, siyempre, we go for cleaning, ganyan, no? Kaya lang sabi ng mga tao, dental treatments are expensive.
Oo nga, yan nga ang sinasabi na dental treatment. Ang katotohanan po niyan, hindi dental treatment ang expensive. What is expensive is our delayed treatment. Yung visit natin na delayed. So, pinabayaan mo yung ngipin mo, lumala siya. Ngayon, pag lumala, yung condition, it entails more complicated procedures, doon siya nagiging expensive. So, neglect is expensive and not the dental treatment. Kaya dapat, we go to preventive treatments para wag nating antayin lumala. Kung saan, pag malala na yung kondisyon ng ngipin, doon siya nagiging expensive because it will entail more complicated procedures. Yun ang nagiging mahal, di ba? So, neglect is what is expensive.
Kasi nga sabi nila,
oral care ang kailangan. Like, you just have to, how often ba dapat, sorry ma'am, kasi ito lagi na to lagi itong problema How often does a person have to brush his teeth? Or her
diba?
teeth?
You have a point there. Ang ngipin natin napakadaling alagaan. You just need to brush your teeth. You need to brush your teeth using Fluoride Toothpaste at least twice a day.
At least twice
So,
a day.
dalawa sa
How
umaga,
long?
importante
Bilis
bago matulog. Oo nga. Diba?
Tapos na. How long po ba dapat? Kailangan ba
Dapat
yun
long
medyo?
enough to clean all the surfaces of your teeth.
Okay.
Tandaan natin maraming surface yan. Taas, baba, sa kanan, sa kaliwa, sa loob, di ba? So, long enough to clean all the surfaces of your teeth. Tapos, dapat, after natin magsipilyo, dudura tayo, wag natin mumuga ng tubig. don't rinse it off with water kasi you need the chemical reaction of the toothpaste with our saliva to release the active ingredient.
May
Diba,
kailangan yan.
yes, diba kino-commercial yan na this toothpaste has this active ingredient to control acidity or to rid of sensitivity. Kaya lang nagmamadali tayong mag-toothbrush tapos babanlawan na natin dahil ang dami-dami mong nilagay na toothpaste, anghang na anghang ka na. So magbubulong ka na ng tubig. So the effect of the active ingredients, hindi pa siya tumatalab, binanlawan mo na, mahal-mahal na.
Oo nga.
Diba?
Very interesting. Hindi ko alam yan na.
Kaya nga po, we have this wrong thinking na kailangan i-rinse mo kagad, di ba? Parang,
Oo, kaya nga, hindi talaga mahalang mag-alaga ng ngipin eh. It's as simple as brush your teeth with the right amount of a fluoride toothpaste, long enough para malinisan mo lahat ng surfaces. Talagang kailangan take time para maabot mo lahat ng mga kasulok-sulukang kaduluduluhan. And you have to also brush your tongue. Kailangan toothbrushin din po yung dila. So this is a very inexpensive preventive measure. Ngayon, hindi sapat ang magsipilyo kasi meron pong mga dumi na tumitigas sa ibabaw ng ngipin, na malapit sa gilagid, na hindi kayang tanggalin ng toothbrush lang. Yan na po yung time na kailangan mong pumunta sa dentista. Napakamura lang po magpalinis ng ngipin. Mas madalas pa baka mas mahal pa yung salon treatment mo or your money ped and your cellphone load. Diba? Hindi po siya mahal. Basta let's focus on preventive.
Yes. So, diba? Prevention is always a lot better than a cure.
Than a pound of cure. Yes po.
Pero when you were saying about yung binanlawan, no, I just noticed, kasi diba usually, i-brush, up, down, diba palagi turo sa atin, there's a certain method. So, and then, pero kasi diba we gargle with water and then we spit it out. So, parang nabanlawan na rin siya.
Ang tinuturo na po namin ngayon, even when we go around the different schools, tinuturuan na namin ng mga bata ng no rinse toothbrushing. You are not to rinse it with water. After you brush your teeth, you just spit the excess toothpaste. Tapos hindi mo na po siya babanlawan. Walang gargle.
Wala nang gargle.
Wala po. Now, if you want to gargle using antiseptic mouth rinse, yung mga mouthwash, you wait for some time na ma-absorb muna ng ngipin and mag-work yung active ingredient inside your mouth. Tapos saka ka po mag-rinse ng mga antiseptic mouth rinse. At wag mo ring banlawan.
O baka pwede din, okay. Pwede na siguro din na, mauna na lang yung gargle bago mag-toothbrush.
Sayang po, sayang.
Okay, gargle ka. Ha?
Siguro banlaw muna.
Usually naman, we gargle. Para hindi lang naman bad breath eh. Kasi diba? I don't know, ganun yung impression ko.
Pwede naman po na.
Hindi alam, no? Ang dami natin hindi alam.
I think pwede naman halimbawa, in between brushing, kung talagang sanay ka kasi mag-rinse off with water para you feel that your mouth is clean. O sige, banlawan mo siya. Tapos i-brush mo uli. Tapos saka ka mag-sit. Don't rinse it off with water. Talaga, ang ina-advocate po natin is no rinsing toothbrushing. Don't rinse it off. You have to let that toothpaste stay in the mouth.
So these chemicals are friendly to our teeth and gums pala, itong mga
Opo, kasi po meron pong mga active ingredients ang bawat toothpaste. Other than fluoride, may mga additives sila. Pero the fluoride
may calcium, may
yes, opo. Pero the fluoride in the toothpaste is the most important.
Kasi di ba, calcium tapos iluluwa mo naman. Yung pala, that's the reason why.
Oo. O nga, yung mga toothpaste, diba, ang daming additionals ngayon, ang daming kung ano-ano. Kung hindi din lang naman pala natin magagamit fully yung mga ingredients na yan, di dapat tubig na lang ang pinang toothbrush, matipid ka.
O, asin.
Kaya lang, wala pong fluoride dyan. Kasi importante talaga to brush with the fluoride toothpaste.
It's the fluoride that protects the teeth, diba?
The may
Opo,
protection.
yun ang importante, yung fluoride.
Okay. Kaya lang sabi nila, ngipin lang yan eh. Diba? It's just a tooth, di ba? Hindi na importante, ngipin lang yan. Sige, pabulukin na lang natin. I know, my employees, that's how they think. Sabi nila, sige, ano na lang, kunyari, di ba, pag may caries, sasabihin nila na, let it just be like that, and then we'll just have it pulled out later on, di ba? Inaantay na lang nila yung oras na bunutin na lang.
Yeah. And they will wait for, yung yung mga dental mission. Actually, nalito ko ng dental mission kasi dati we used to do a lot of dental missions. Kawawa yung mga dentista. Kaya kinukuha namin mga military. Kasi talagang talagang puro extraction lang.
I have my share of that. Opo.
Kailangan palitan. Pero there came a time na nag-invite na kami ng provincial dentist. Sabi namin, baka pwede mo magturo. So, nagtuturo muna yung during the dental mission.
Totoo po yan.
Kasi may sponsor kami ng toothbrush.
Ngayon po, ang PDA, ina-advocate na namin na wag na puro bunot sa mga dental mission. Meron kaming tinatawag ngayon na dental home kung saan primary care ang pwedeng ibigay sa pasyente. Hindi puro bunot lang. Tandaan po natin, when you lose your tooth, you didn't lose just your teeth. You also lose bone attachment, pati yung buto, humihina. At ang ngipin naman ay hindi lang para lang magandang tumawa. It's not just for aesthetic. Na-mention ni Ma'am Betty earlier na 'di ba? Kaya nga wound to tomb kasi kailangan natin kahit hanggang pagtanda natin ngumunguya tayo eh. Kung wala na tayong ngipin, hindi natin madurog yung pagkain. So hindi ka matunawan, and a lot of patients have difficulty eating when they lose their teeth. Hindi lang talaga dahil sa ngipin yan. And remember, sige, antayin na lang natin mabulok yung ngipin. Eh di meron kang breeding ground of bacteria inside your mouth. Dahil hindi mo pinapagamot at aantayin mo na lang mabulok. It is connected to overall health. There are studies, evidence shows that there are diseases that are aggravated by bacteria that is resting inside the teeth and around the gums. So, we advocate not just the care of the teeth. Ngayon po, ang ina-advocate natin is the care of your teeth, your gums, and your bones. Kasi magkakasama po lahat yan.
Holistic siya.
Yes, holistic na po talaga. At pag pinabayaan natin ang bacteria na yan na mamahay dyan sa loob ng bibig ninyo, nalulunon nyo po yan. So ano mangyayari po? It goes to your kidneys. If you are pregnant, it goes to your mom, which can be connected to low birth weight. Kaya pala yung bata, napakaliit, napaka-frail. Kasi maraming bacteria na galing sa bibig ng mommy. May studies po yan, hindi po yan. These are evidence-based studies which connects to the overall health. Diabetes, hypertension, kidney failure, and low birth weight. Napakadami na pong mga studies yan na kinokonekta na ang ngipin po talagang hindi natin dapat pabayaan kasi konektado siya sa pangkalahatang kalusugan po ng katawan.
Because everything, it enters, di ba? What enters our mouth enters our body, no?
And tandaan po natin, kagaya po ngayon during the time of the pandemic, there are studies that came out that it is connected to periodontal disease at COVID. Yung mga merong periodontal disease, sila po yung mas nagkakaroon ng mga complication kapag ka nagka-COVID sila. Kasi tandaan nga natin, yung, as I mentioned earlier, di ba, yung bacteria, it goes to your system. Nagkakaroon ka ng tinatawag na comorbidities. So kung may diabetes ka, tapos meron kang periodontal disease, tumalala yung diabetes mo. May mga patient po na who goes to my clinic na who would need dialysis or kidney transplant or open heart surgery. Kailangan tanggalin lahat ng mga bulok ng ngipin. Kasi during the time of surgeries or during the time the patient will recuperate, may bacterial source inside the mouth. Ayaw natin yan. Pati those who would undergo some bone surgeries, sinisiguro ng mga doktor na walang bulok ng ngipin, walang pagsisimulan ng bacteria. Kaya
tsaka
importante.
Yung bacteria sa teeth, di ba nakatago lang yan? Hindi naman natin nakikita yan eh.
At hindi natin malilinis yan.
Yes.
Mahirap siyang
Oo,
maintindihan kasi
nasa loob,
the,
especially
the
kung nasa loob.
yung ngipin natin na bulok becomes a breeding ground for bacteria.
Correct.
Pati yung hindi nagpapalinis ng ngipin, tapos namamaga yung gilagid, it becomes a breeding ground for bacteria po.
Infectious diseases, yeah. So ano po, if I may clarify lang, ano ba yung periodontitis na?
Periodontitis po ay sakit sa gilagid dulot ng mga bakterya na namamahay dyan po sa mga dumi na nakapalibot sa ngipin kung tayo ay hindi nagpapalinis ng ngipin.
Yung, tsaka kung nagsisipilyo, ganyan.
Opo,
Or,
ang mangyayari, laging merong bakterya doon sa mamamaga yung mga gilagid, tapos pati yung buto na kinakapitan ng ngipin bumababa. Kaya ang pasyente, nagdudugo ang ngipin, umuuga ang ngipin hanggang sa minsan kusang nabubunot na yung ngipin. Dahil nasira na, nakain na ng bakterya yung buto na kinakapitan ng ngipin. So that is periodontitis.
Wow. Parang it's a dangerous disease pala. So we have to really be careful. So ano po, galing, very enlightening ang ating mga ngayon, yung especially itong mga wrong mindsets. Ano po ba yung isa pang mindset na do you think
wrong mindset and practice actually, diba? Wrong mindset and wrong practice. And wrong beliefs, diba? Yun na, sabi nga nila, ngipin nga lang yan ano ngayon, ngipin nga lang, hindi naman siya importante. Pero sabi nga ni Doktora, our teeth is actually very important kasi nga it is a breeding ground for bacteria. So, pwede siyang mag-cause ng madaming diseases. I remember nga one auntie of ours dati, 60 plus. Dati kasi ang mga tao pag 60 plus ka, malakas ka na eh. So, ang tagal-tagal, hindi mahanap kung ano ang diferensya sa kanya. Nung huli, at saka na lang nila na-discover, meron yung nag-iisa niyang ngipin. Ang daming bacteria. So, nung binunot, okay na.
Yes, yun. I have a lot of cases in my clinic po na we discover na yung paulit-ulit na may inflammation, laging may namamagado sa pasyente, nanggagaling sa isang ngipin na naiwan, hindi napansin na may natirang ngipin na laging nagkukos ng pamamaga niya. Kaya talagang importante po yan.
Yes.
It's not only for the function of eating, it is also important in aesthetics. Minsan, akala natin yung pasyente nagpa-facelift, yung pala pinaayos lang yung ngipin niya. Kasi pag naayos ng dentista yung bite, when all your teeth are fixed, naayos yung bite mo, na-restore yung tamang contacts ng ngipin, makikita mo how the face will glow. Ikumpara mo yung pasyente nung wala pa siyang ngipin, tapos bigla siyang ginawa ng magandang prosthesis, makikita mo kung paano nag-glow up yung mukha ng pasyente. And that creates a positive vibes, a positive feeling to the patient, which will add to gumaganda rin ang feeling ng katawan natin, di ba? Lumulusog yung katawan natin.
Yeah, yes, and also kung alam natin na maganda ang teeth natin, everything is in talaga top shape, even the self-confidence, level natin, boosted talaga yung, di ba? We're so confident, we can talk. Pero ngayon kasi sadly, naka-mask kasi ngayon mga tao. Sabi, let's not prioritize din. Pero actually, pag hindi maganda yung dental health mo, maaamoy mo sarili mo, di ba? So it's one indicator na you need to go to that.
Sadly po, there are people who they have halitosis and they are not aware na mabaho yung kanilang hininga. Kasi
ano po yung halitosis?
Halitosis po is bad breath. So may mga tao po na meron sila pero hindi sila aware.
Tapos magiging aware sila.
Kailangan lang pala magpalinis ng ngipin. At dahil
kasi may face mask sila.
Siguro kaya yung iba ayaw magsuot. So sandali inaalis. Reason why. Sorry, seriously, po. Kailangan talaga ayusin talaga yung ating oral health, no? So, kasi yung wrong mindset niya, yung fear, and instilling fear among the children, and the young people, and also a wrong image about the dentist na ito, walang ginawa kundi magbunot, at saka yung wrong perception na magastos, di po ba? Because prevention is a lot better than cure, di po ba?
Cure. Even in dental health, 'di ba? It
Opo.
works for medical health. We always say prevention is better than cure. Pero sa totoo lang, even in dental health ganyan din, 'di ba?
Opo.
And
Opo.
yun na nga, madaming functions ang teeth natin. So, huwag naman natin maliitin yung ngipin natin, 'di ba?
Yes.
Our teeth, they helps us with our digestion, and if we take good care of it, we prevent the bacteria from entering our system. It's actually part of boosting. Sabi nila, mag-boost ka ng immune system. Sa dental naman, it helps us to lessen the bacteria, lessen our chances of incurring sickness. Diba? Prevention.
Okay.
It's really a tool for prevention. Yun. So si Doktora, alam mo, si Doktora, yun na, sabi ko nga sa'yo, kahit na 2 oras tayo, hindi tayo matatapos. Kasi
yung
si
topic
Doktora,
naman kasi natin, very important. At saka, ang dami nating misconceptions, marami tayong hindi alam pala.
Tsaka wrong
Actually, I have a sister who's a dentist, ortho, tsaka brother-in-law. Pero syempre, di kami masyado nagkakwentuhan. Hindi ko alam, marami akong nalaman ngayon na narinig ko lang sa iyo, Doktora, no? Like yung pag-spit out, yung pag-gurgle.
Yes,
importante yun, no? Yung iwasan yung pag-rinse ng toothpaste.
Actually, madami din kasing, I think the dental profession, kasi tayo dati, palagi ang iniisip natin, we go to the dentist for extraction, diba? For cleaning, for pasta, for root canal. Talking about root canal pala, naalala ko. One nice
Nakatakot yung root
experience.
canal na yan.
Hindi, ang nakakainis sa root canal kasi, di ba, nakanganga ka. Ang tagal-tagal, di ba? Kung minsan, how many minutes, ang dry-dry na yung throat mo. Tapos biglang lulutod ka. Di lahat
Tinutulugan mo nga po, di ba?
Actually po,
natulog ako.
Ayun, si Ma'am.
You can experience a pleasant root canal treatment po if you go to the proper dentist who is really equipped with doing the procedures, kasi hindi naman yan pwedeng basta nakanganga ka lang for the longest time. We use special dams, we call the rubber dam, which will isolate your teeth. So kahit nakanganga ka, since meron ka nung dam, hindi ka naman mag-breathe through your mouth, so hindi ka matatakot. Now, the procedure also becomes faster with the use of the gadgets. Marami kaming mga advanced na mga equipment na ginagamit, which makes the treatment na mas mabilis na gawin ngayon, unlike before na napakatagal. At saka hindi na po nakakatakot magpa-root canal treatment. Kasi nga, with the technology, with the advanced technology and dentistry, ang Pilipinas po, hindi po tayo nahuhuli sa technology. Ang mga dentista po natin are very much equipped and trained. Meron po tayong mga specialty societies who trains us, tinetrain kaming mga general dentists to be able to practice in a specialized way. May mga standard protocols na ginagawa po. Kaya talagang hindi na po yan nakakatakot. You just need to go to the right people who will treat us, kasi like the physicians, meron talagang specialties. May mga dentists na dito siya magaling sa linya na to. You can always go to dentists who are specialists or they specialize in these treatments para wag ninyong ma-experience yung unpleasant na experience sa pagpapagamot. And I just need to add, I might forget kasi, sorry I just need to add that caring for your teeth also has to do with what we eat. Hindi lang kahit maglinis ka na, kahit maglinis ka na maglinis ng ngipin, kung habang nasa online class ka naman for 8 hours, inom ka ng mga matatamis na inumin, kain ka ng kain na matamis na pagkain, kailangan din po natin ng healthy diet. Importante rin na to eat the right food. Talaga, ang pag-aalaga sa ngipin natin talaga, it has to do with our overall health. Holistic yan. Hindi talaga, sige, kakain ako ng kakain nito kasi total magtutoothbrush naman ako. Hindi. Because the sugar also goes to our blood. we also
Yes. No.
digest it. So
Yes.
we
Right.
have an advocate in the PDA. We started an advocacy against eating too much sweets.
Sweets.
So
Yun.
we
Okay.
discourage ang masyadong intake of sugar sweetened beverages. I would not
Mm.
want to
Yes.
say any name or brand, pero pag
Yes.
sinabing sugar sweetened beverages, alam na po natin yan, mga
Mm.
iced tea, mga soft
Opo.
drinks,
Yes.
mga milk
Okay.
tea. So
Almost.
we can start drinking more water kasi mas
Mhm.
healthy naman talaga ang uminom ng tubig,
Water.
and to
Yes.
drink the mas masustansyang mga pagkain, to eat
Yun.
Pwede naman
vegetables and
mag-drink
fruits.
Yes.
ng gusto. Gusto
Yeah,
vegetable
vegetable.
powder juice. Sabi ko nga, di
Mm.
ba, kung kunyari after na mag-surgery, di ba, pag hindi nakakain or in-adjust yung mga
Oh, yes.
braces,
Opo.
yan, pwedeng mag-gusto vegetable powder juice.
We
Mm.
usually encourage our
May
patients,
commercial.
we encourage our patients lalo na after surgeries to hydrate,
Mm.
na talagang uminom
Yun.
sila, and they have
Yeah.
to supplement with nutritious diet.
Okay.
Lalo na kasi
Yes.
pagka naka-soft diet na sila, talagang we really
Mhm.
ask them to supplement their diet with nutritious diet
Yun.
para
Bagay na bagay.
sumasabay
Understood.
ang paglaban ng immune system ng katawan mo
Mm.
to enhance healing, lalo na after surgeries.
Okay.
Ayan.
So,
Pa-plug ko na rin,
yeah.
doktora, yung 15 biota namin.
Ayan.
Kasi it's probiotics. Sabi ko nga, I always, I would like, when we're talking of changing of mindset, probably I would also like to change the mindset of dentists na,
Mhm.
like for example, yung nag-prescribe sila ng antibiotics, di ba? So, after 2 hours, sana mag-take naman ng probiotics kasi it
Probiotics.
brings back the good bacteria in the system. Yun.
Okay.
Pero doktora, I understand, madaming klase nga eh. The dental profession has already matured in a way na marami na rin specializations, 'di ba? Yung mga dentist. So, and I understand doktora, you have a clinic, 'di ba?
Yes.
By Brand Smiles.
Mhm. Yes.
So, what does your clinic specialize in?
Based on my experience and my training, I do a lot of endodontic treatment and periodontal treatments. I do surgeries and prosthodontics and cosmetics.
I will
Parang
share
inano
you.
yan eh, parang kinombine ko kasi na I want to save the teeth. After I
Mm-mm.
save your teeth, if I need to do surgery, then I would need to replace it with a prosthetics or a prosthesis, pwedeng veneers or dentures or implants or denture-supported implants. So parang doon nakafocus ang treatment ko in my clinic. My daughter will be a dentist soon.
Oh,
Hopefully, sana yung hindi ko,
Congratulations.
oo,
you
sana
have a
she
daughters
can,
already, in
oo.
dentistry proper?
Oh, yes. May
Oh,
daughter po ako na
wow.
malapit na maging
Oh,
dentista.
you look so young
Sabi
for
ko sa
that.
kanya, sana she can engage in other areas of practice where I am not involved in.
Okay.
Pero
So,
gusto rin niya ng surgery.
so ito po yung page. So you can see it on the screen. Vibrant Smiles, like it. And for more information about, if you want to, inquire or get a schedule, yan. Si Dr.
Yeah.
Christine. Ang ganda ng nung cover photo, no? You see? A
Thank
very
you.
friendly dentist, or tooth
Oo,
doctor. Yeah.
nakatawa yung teeth, no? 'Di ba? Hindi na siya scary. Hindi siya
Yes.
scary, nakatawa
Yeah.
siya. Sabi
Pero
niya,
ang
Kasi,
ganda ng,
take care of
yeah,
me and I'll take care of you.
correct.
kasi
Pero
I'm an advocate of
yes,
safe dentistry and effective
ayan.
dentistry, meaning providing treatment that is less painful. If I cannot make it painless, I would want to
Okay.
make it a pleasant experience for our patients. So I'm an
Yun.
advocate of that. That's why I trained in Japan to study dental anesthesiology. Kasi gusto
Wow.
ko talaga na yung mga pasyente who has anxieties, they can be given an opportunity to experience a pleasant dental treatment para mawala yung mindset na nakakatakot at masakit and all.
Okay po.
Eh,
So
kasi
you
nga,
also
ang
do
dami.
online training, Nagte-training din online si
Because,
Doktora. Ayan,
yes, nai-invite tayo paminsan-minsan to lecture.
Okay. So
Kaya
it's
nga
a
eh,
very
she has a big
interesting ano po,
heart.
page. Yeah. Yes, yes po.
Si Doktora has a very big heart kasi nga aside from practicing her profession, she still found time na to teach other people kung paano kumbaga parang paano dumami ang tribo ng mga safety concern na dentist, di ba?
Yes,
Yun
kasi
yung
talaga.
maganda kasi oo, that's what I like with Doktora kasi alam mo yon, even nga yung topic natin for today, sabi na, what can we talk about? Ang dami din palang kailangan i-change sa mindset natin.
Oo, especially sa Philippines, no? I was about to say nga kanina, ang wrong laging kasi huwag tayo masyado maniwala sa sinabi ng matatanda na with regards, especially sa dentistry, kasi po, yung iba yung technology before, iba yung ngayon. Kasi ako,
Opo.
I experienced when I was young, wala pa nung wala pa rin yung topical na topical anesthesia. Talagang
Oo.
injection talaga. Oh my
Oo.
gosh, diba?
Karayom
Pero
lang, ang
ngayon,
laki-laki
topical
na.
Oo nga po. Pero ngayon, meron na rin topical before ilagay
Oo.
yun. Diba? So painless na talaga. Most of the time, painless na. Kaya lang nagiging painful yan pag paga na.
Oh,
If it's
yes. If you wait na
Mm.
lumala na yan, that's where the treatment becomes more complicated. Lalo ka na tuloy matatakot kasi in pain ka na.
Pero hindi naman po, the dentists nowadays, hindi na po nag-extract pagka namamaga, di po ba?
And we have to manage the inflammation first. We want to lower down the infection before natin i-treat ang pasyente. Case-to-case basis. There are cases na kailangan mo na rin tanggalin to help to relieve
So,
the
avoid that,
inflammation
guys.
para
Pag
wag
hinihintay
mag-spread.
mamaga yan.
Yes, wag na natin hintayin lumala. Ang dali-daling mag-toothbrush.
Magpa-clean
You can
lang, mag-toothbrush, magpa-cleaning, ganun lang, very simple.
and eat the right food.
Eat the
Eat the
right
right
food.
food, tama.
And
Lalo na at the time,
immunity.
yes, lalo na ngayon at the time of the pandemic where it's
Yes.
hard to get an schedule kasi nga limited lang ang nagagamot namin because there are so many protocols for infection control na
Bawal ang
kailangan namin
pila-pila
gawin
Hindi
in
pwedeng
between
pumila
patients. Oo.
sa mga
So take care of our
walk-in.
teeth.
Yeah.
Alagaan natin siya ngayon. Huwag natin antaying lumala kasi it's hard during this time.
Okay. Big ink. Ayun po, Doktora, we've learned so many things today. Medyo marami na break na mga ang tawag din yung mga old mga myths
Old
about
beliefs.
old beliefs. Kasi modern na ating mga dentists. So don't be afraid. Yung mga kwento ng mga lolo-lola, that was ages ago. No? So, iba na ngayon po. Millennial, tsaka Gen Z era. Okay. Sige po.
So let's wrap up, no? Siguro today, what we learned from Doktora is, number one, sabi nga nila, dentists are not really that scary after all, diba? Because of the advances in science and technology, painless na ang dental procedures. It can be done that way, diba? And then sabi nila, dental treatments are expensive. Hindi din naman totoong expensive. What is expensive is neglect. Diba? Neglect is expensive. The dental treatments, hindi naman siya. Kasi like for example, if you like just go for cleaning, magkano lang ang cleaning? It costs less than your load. Diba? Pagbawas lang kayo ng load, pwede na kayong magpa-cleaning ng ngipin. And then the third is, do not make it a mindset na it's just a tooth. It's really an important part of our health, diba? Kaya nga doktora din ang tawag sa mga dentist, diba? They are part of the health system. So pag palagi ang sinasabi nyo, you boost your immune system, you should also include taking care of your tooth, diba? Because that is indeed a part of your dental health care. So Doc Chrissy, baka gusto mong ibigay yung contacts, how will people find you naman?
Opo. And your
Ah,
final, ano po, yung takeaway na final
yung
as you wrap up.
takeaway na lang, or I just want to reiterate that it's really easy to take care of your teeth. You just need to brush your teeth twice a day with a fluoride toothpaste. Brushing is mechanical. It means that you need to take time. Kahit gaano ka-expensive ang toothpaste, if you don't take time to clean your teeth, then it becomes useless. You brush your teeth with the fluoride toothpaste, don't rinse it off. Let the active ingredient work inside your mouth. You have to eat the right food. And you have to remember to go to your dentist and make sure that you go to a licensed dentist para sigurado ka that you are given the right treatment. Wag nating wag nating isipin na yung ngipin natin is for fashion, na we'll go to this online supplier or seller that will give us fashion something in our mouth. Nauso yung mga fashion braces. Baka instead na mapabuti yung ngipin ninyo, lalo pang lumala at masira yan. When you take care of your teeth, you have to remember that you are not just taking care of your teeth, you are taking care of your overall health. Yung ngipin nyo is embedded in bone, covered by your gums. So you look at taking care of your teeth, your gums, and your bones. And your teeth are not just for display. It helps us to have a good overall function of our body. So baguhin natin yung perspective natin on how we look at our oral health. Kaya nga tinawag na oral health. Yung buong bibig yan. We are experts not just of the mouth. We are experts of the head and neck. Maraming mga dentista na who treat patients with chronic headaches. Yun pala, kailangan lang ayusin yung ngipin, nagiging source ng mga headaches, mga masakit ang batok, masakit ang likod. The teeth is connected to the whole body. So baguhin lang natin yung tingin natin, yung perspective natin. And remember that the dentist, we are your friends. You can always consult us. Most dentists hindi humihingi ng consultation fee. So wag po tayong matakot. If you have anything in your mind, there are some dentists who would ask for a consultation fee, but most dentists, we do not ask for that. So wag not because there is an over-the-counter drug, kasi yun ang mahirap masakit. So bibili na lang ako sa tindahan ng gamot because I can buy without prescription, kaya lumalala. So let's not wait for things to get worse just because pwede naman mag-over-the-counter or mag-self-medicate. You go to us. You can always ask for a consult and lay down the cards. Ano ba yung kailangan mo? We can always give you a treatment based on your needs, based on your status. Marami na po available dyan.
So, Doc Chrissy, pwede na mag-messenger sa'yo?
Yeah,
Yes,
PM is the key. PM is the key.
You can just go to my page, Vibrant Smiles page.
Yes.
I do a lot of teleconsult. There are a lot of patients to consult.
Chat
For free naman po yan. Information should be given for free because information is very powerful.
Yeah.
So get the right information. Go to an expert and get the right information.
Especially ngayon, during the internet age, di ba? Sasabihin nila, nakita ko sa internet, nako, hindi mo na alam kung ano fake news dyan. So, we're very happy.
Yeah. May pahabol lang dito Si Shioni Tan. It's okay, let's accommodate her. Sabi, how long should we chew our food? Kasama pa yun
long enough that you are able to grind it, because digestion starts in the mouth. So if you did not grind your food or chew your food well, then there is a possibility, hindi lang naman yan yung sa panunaw absorption of the nutrients in the food. So you have to chew it long enough that you are able to grind it down so that you can absorb, kasi digestion starts in the mouth. That's how important our teeth are.
Oh, yes.
Siya ang simula ng lahat.
Wala kang ipin. Wala kang pang-grind.
Ganun siya ka-importante. Not just for speech. Diba? Speech and eating.
And smiling, not only for smiling.
Aesthetics.
Yes. Okay, so napaka-importante. I hope you will have also another, we can have another 1 hour with you, Doktora. Talaga, some other, important facts about oral care. Kasi talagang ang dami-dami nating mali, ang dami-dami nating misconceptions, wrong beliefs. So, we also thank you because you have a very good advocacy and pasok na pasok dito sa ating advocacy rin, Ma'am Betty, no? Health
Oo.
Revolution.
She has a very big heart din. Alam mo, that's what makes her different from the other dentists that I have known. Although meron din madami din diyan. I know they have they do
Yes, marami
ang
yan.
dentists, they do dental missions eh. Yun yung di ba? And
Yes, yes.
that's how they try to help people. Pero yung
Yes.
information, si Doc Chrissy is she has a big heart for sharing
Generous for
information.
sharing.
Oo.
Okay.
Kasi siya research, she does a lot of research,
Okay, that's
and then
great.
continuously, and then she also helps she trains the other dentists.
Dentist, okay.
So
Spreading,
thank you very much,
spreading the
Doc
good news.
Chrissy.
Yes
Oo.
po. Thank you so much. Yes.
Oo.
The honor
Sana-
is mine po.
Thank you.
Likewise.
Sana pero trabaho ni Raymond, to put it on YouTube para anytime
Yes,
people
wow.
can view, and we hope that with
Yes.
the small act that we did today, we will be able to change more mindsets, diba?
Correct.
So,
Yes,
mga
anytime po, not you need to,
revolutionaries. Yes, see you
anytime you
all.
need to announce anything, just let us know po. We will be more than glad
Oo.
to help you spread the word, spread the good word. Okay po,
Yes,
the tooth gospel.
Okay. Ayan.
Okay po,
May
so
bagong
next week na pala. Yes po, next week we have Sir Josiah Go, for our
Yes.
our Wednesday lunch date. Josiah Go, next
Oo.
Wednesday. So,
Ano naman yun? Pera, negosyo naman ang pag-uusapan.
okay.
Ayun.
So,
Business model.
okay. Because lack of money and too much money causes health problems. So we have to know all these things also. All right. So thank you so much once
Practical lang
again.
naman. Business model change for MSMEs.
Oh wow.
Ayan.
Good. Oh, tama. We have so many
And,
more. 90% di ba, or more are SMEs. Okay, don't forget Vibrant Smiles, ang Facebook page ni Doktora. Ayan po, finish ko. Vibrant.
Ayan.
Thank you.
So, pag may mga questions kayo, kung and you need consultations, yun, kahit na pandemic, the Clinic of Doctora is open to serve you. Ayun. So, dapat tayo, Raymond, pupunta na rin.
PM is the key. PM is the key. Okay. All right. So, thank you, guys. Thank you sa mga nanood. Got mga friends ko nga, nanonood from nasa sila Shuttle, sila Raldi, si Patricia nanonood. Thank you rin kay Ray at saka kay Shoni Tan and the rest of the people watching. And also those who will watch this on replay because this will be published sa mga pages po natin. Health Revolution, My Big Eight, HTV Philippines. All right. Thank you.
Thank you. Okay.
Doktora, thank you so much.
Bye, Doktora.